Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program designed to educate you about naturopathic medicine. Today is February 26, 2013. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the past 24 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. We have a great program lined up for you today. Just the presence of today's guest is incredible in itself. Incredible not for who this person is, but for what this person has. Today's guest has been on Island Wellness television twice before, and if you saw or heard his story, you certainly could not have forgotten him. What makes Jason's appearance with us incredible is because he shouldn't be here today. In fact, he should have been dead for about several years now. Jason has the incurable and deadly genetic cancer von hippel-Lindau disease. Well, we'll give you the details about von hippel-Lindau disease in the next few minutes. Before we meet our guests, let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that the human body has the mechanisms in it to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, a physician's true role is to support this process by using modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Well, that's about me and naturopathic medicine. Now let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine with you so that you can get a better understanding of how this safe and effective form of medicine works. I'm sure most of you have never heard of von hippel-Lindau disease before tuning into Island Wellness. Von hippel-Lindau disease is a very rare genetic disorder. It occurs in 1 in every 30,000 to 80,000 people. Von hippel-Lindau disease is an autosomal dominant disorder caused by a defective tumor suppressor gene at chromosome 3p25 and 3p26. This typically means that in these individuals, the immune system's ability to battle cancer cell growth is non-functional, turned off, destroyed, and basically does not work. Cancer cell growth goes unchecked. It is swift, unrelenting, and widespread. Typically, cancer growth targets the retina in the form of retinoangiomas, that's eye tumors, brain and spinal cord hemangioblastomas, that's brain and spinal cord tumors, renal cell carcinomas, that's kidney cancer, endolymphatic sac tumors, pheochromocytomas, that's adrenal gland tumors, papillary cyst adenomas of the epididymis, angiomas of the liver, kidney, and cancerous cysts of the pancreas, kidney, liver, and epididymis. Renal cell carcinomas affect 60 to 75% of these individuals, resulting in a high mortality rate and low life expectancy. Renal cysts in themselves are seldomly clinically significant. However, in von hippel-Lindau disease, they have an enormous rate of malignant transformation. The average age at which these patients with von hippel-Lindau disease develop renal carcinoma is 44 years of age and is the most common cause of death. The second most common cause of death is central nervous system hemangioblastomas. Approximately 70% of individuals affected develop these tumors. The mean age of diagnosis is age 25. 80% of these central nervous system tumors develop in the cerebellum and 20% in the spinal cord. Although hemangioblastomas are usually benign, the continued enlargement of these tumors within the confines of the cranium and the spinal cord can cause great neurological difficulties and cause death. According to conventional medicine, genetic disorders like von hippel-Lindau disease are typically untreatable and incurable. A diagnosis is established if the patient has more than one central nervous system hemangioblastoma or more than one hemangioblastoma within the abdominal cavity, or one manifestation of the disease in a known family history. However, von hippel-Lindau disease is confirmed by genetic testing. The growth of the tumors are monitored by MRI or CT scan. Because von Hippel-Lindau is an autosomal dominant disease, the affected parent passes the defective gene to the child, and each child has a 50% chance of inheriting the defective gene and the disease. Both sexes are affected equally, and all races are affected. Furthermore, genetic mutations at chromosome 3p25 and 3p26 can occur spontaneously in about 20% of the cases. Symptoms typically begin in the 3rd or 4th year of life. The typical conventional treatment is symptomatic, basically surgically removing the tumors as they develop. Because von Hippel-Lindau disease is caused by a defective tumor suppressor gene, abnormal cell growth goes unchecked. Therefore, tumor growth is constant, and it is not uncommon for individuals with von Hippel-Lindau disease to undergo 2 to 3 surgeries every year for many years in a row. Thus, the patient typically succumbs to a tumor affecting a vital organ, or too much of an organ's tissue has been removed to sustain life. The prognosis for individuals with von Hippel-Lindau disease is dire. Most stricken individuals do not live much longer than 3 or so years after the diagnosis. The average life expectancy is 49 years of age, and Jason is older than that. My patient Jason has returned to update us on his courageous battle against the very rare and deadly von Hippel-Lindau disease. Now that you have a better understanding of the immense battle that Jason is undertaking, let me introduce our special guest. Jason, thank you so much for joining us on Island Wellness. And thanks again for letting us parade you out on television again. This is Jason's 3rd time in about maybe 6 years now on Island Wellness. Jason, people always ask me, how you're doing, if you're still alive, and I'm sure many are thinking, sure, naturopathic medicine may have kept Jason alive for about 5 years, but that could have been a fluke or coincidence. Is Jason still alive 8 years later? Because that would be significant. And also, if you're still alive, are the von Hippel-Lindau disease tumors still absent? That would be interesting. But, obviously, you're here, so maybe we could end the show right now. But for those for the audience that have never heard your story before, it's an amazing and incredible story. We were talking earlier about some of your physicians kind of amazed at where you're at right now. So for the audience, don't move, because this is going to be a story you won't forget. So Jason, take us to the beginning, before all this happened. How and when were you diagnosed with von Hippel-Lindau disease?
Let's see. I was doing a remodel in my house.
In your house?
Yeah, this was in '05. Must have been about Halloween. And I strained my ab muscle, and it was painful when after a meal, and I would breathe. Just breathing was painful. So I went to my doctor, and he says, you have an abdominal tear, and we'll do ultrasound and look at that tear. And during the course of that ultrasound is when he found the cancer in both kidneys.
Mm-hmm.
And he had to call me in. But at that time, we were both unaware that I had von Hippel-Lindau syndrome. So it was just, found something amiss, and it's going to have to be dealt with.
Right.
So that was about Halloween '05.
Okay.
And it wasn't till '06, after I had gone through 2 surgeries already,
okay,
that they were starting to figure out, narrow it down, what was going on with me, because I had cancer in both kidneys. So
yeah, typically if it's a angioma, they would consider that von Hippel-Lindau disease typically, right? If you have 2 abdominal cavity hemangiomas.
That didn't come out though right away.
Yeah,
they.
I mean, it's very rare, right?
Yeah,
So I'm sure maybe
yeah.
they got lax, but they were probably wondering what was going on.
And a lot of times the von Hippel-Lindau, I'll call it VHL, that
Okay.
shows up like in your eyes.
Right?
And my eye doctor contacted him about that. He said he did not see it. Generally, he sees it first before the other doctors, and he alerts them. So he said this one was kind of backwards, like
Yeah,
we
yeah.
found this thing, and now we're asking him, and he said no, it's not.
There's nothing in the eyes.
Yeah,
No
so-
retina hemangioma.
So it was a good thing,
Yeah.
and it wasn't until what is that you call the epididymis thing?
Okay.
That was the one,
So they found that on you.
and then that's when they linked it together and says you have von Hippel-Lindau syndrome.
Okay. So, and they were also ran genetic testing.
Yeah, so that was the response from the genetics people after we started to get all these things come up. So we started to narrow it down
Okay.
so first it was something like tuberous sclerosis or something.
Oh, okay.
They
Yeah.
were trying,
yeah.
they figuring, they go, no, not that, and then finally they go, okay, now we know what this is.
Okay.
And
And how did you learn about what VHL?
oh, they gave me a
was?
pamphlet.
Okay. So they didn't have the courage to talk to you about
They
it.
did talk to me about it. It was pretty grim, and I must say I was like in denial.
Okay.
Yeah,
Yeah.
I was in denial.
Oh, yeah. I would think most people might
Yeah,
want to be in denial with that type of diagnosis.
I just didn't want to, go down that dark path and spiral. But I was pretty much in denial and
Hmm.
didn't want to.
And this was in about 2006,
2006, yeah, after I had gone through 2 surgeries already.
right? Two
So-
abdominal surgeries.
Yeah, absolutely.
Okay.
And I would think that would be it. And here we're coming back with there's going to be more.
Yeah. I mean, abdominal surgeries, major surgeries. right?
Correct.
They take a lot out of you.
Yeah.
Yeah.
So they cut you like they call it the chevron cut. So
right
it's like
below the rib cage.
like the biology frog.
and they
of
kind
thing.
of, yeah.
Basically, that's
All right. So I'm not going to ask you how you felt about the diagnosis. I guess you kind of mentioned that it was pretty grim.
absolutely.
Yeah. And then why did you want to see a naturopath at that point in 2007?
It's interesting when you have this kind of a condition. Like your family and friends mean well,
Mm-hmm.
and everybody was like bringing me things to try.
Yeah.
And there was a whole slew of things that
Yeah.
they brought,
Yeah.
and little potions and what have you. And
Yeah. I'm sure it could be overwhelming.
it was, and then
I mean, you could have like 50 or 80 things
Yeah.
that you have, and what do I take?
and then if I get good results,
Yeah.
which one was the one?
Right,
You
right.
know. And
Right.
so it was my wife that was talking to me about the alkaline diet and the naturopathic program, and so I said, okay, and out of desperation too,
Mm.
you just don't want this to continue anymore.
Yeah,
So,
yeah. So you just figured you give it a shot.
Absolutely.
Hail Mary pass.
Absolutely.
I mean, why not, right, when you have
Yeah.
that diagnosis? All right. Have you ever met anyone else with von Hippel-Lindau disease?
I've heard of people, but I've never met anyone.
Okay.
It's so rare that It's like 1 in 30,000 or something.
I've read from 1 to 30,000 to 1 in 80,000. So
Mhm.
it could be maybe another 10 or so in Hawaii.
Yeah.
Yeah, but yeah, pretty rare. The first visit you came in to see me, obviously you knew I had never treated von Hippel-Lindau disease.
Oh yeah,
before.
you're quite honest about that.
Yeah. So I told you I don't know if I can help you because according to medicine, genetic cancers can't be cured. So there's no real treatment, and I've never treated it before, so I don't know if I could really help you. But you had mentioned that you were interested in the alkaline diet, which gave me hope because that would be, to me, the only hope we had in trying to control the von Hippel-Lindau disease. Because according to scientific theory, cancer cannot grow in a body that's slightly alkaline in pH, and that's what we had to do for Jason. Make his body slightly more alkaline, but not too alkaline, so it's a fine balance. So, what did we have you do for the treatment?
Well, there was the diet.
There's always a diet.
Yeah, which was, again, a little pamphlet that what you can eat, what you cannot eat. And so I had to get into this mindset of I can continue on my path, eating whatever, and, go along my merry way and have it recur, and then finally I expire from it. Or by changing what I put in my mouth, I have a chance, hope, and can live a long life.
At that time on the first visit, we were talking about the diet that could help you. Did you have any hope that the diet would help you? What was your feeling about the treatment anyway? Because we did more than the diet. We gave you some supplements.
I was skeptical because at that time it just seemed odd that what you eat could have that much effect on your overall well-being. Now I know, but back then I thought I ate pretty good. So it was a awakening for me that was actually quite a blessing to me.
Yeah, it was. Yeah. So I'm sure the audience are on the edge of the seat. What did you have to eat on this diet, or what could you eat, and what did you have to cut out?
Well, first of all, I just like to call it rabbit food. You're gonna be a lot of fresh vegetables and fruits, and I got into juicing, and there was episodes with wheatgrass that that was interesting. Let me put it that way.
Yeah, very strong taste.
Yeah.
So Jason, what foods could you eat on that diet, and then what foods did you have to avoid?
Okay, I started getting into oatmeal.
Okay.
And cut out milk. And I was doing a soy milk.
Okay.
I remember doing that. And then instead of sugar with my oatmeal, I was using fresh fruits.
All right. Yeah.
For the sweet.
Okay. And you had to eat a lot of fresh fruits.
Yeah.
And vegetables.
Fresh fruits and more even vegetables. And it was kind of tough, but I can say that after the second week, your taste buds kind of change, and then you really start to seriously taste things.
Yeah.
So.
Yeah, vegetables actually do taste sweet.
Not bad. Yeah, I was I can really get into this, and we were doing some kind of cracker thing. It was a sesame seed something or other.
Oh, okay.
And then I cut out bread and processed flour, any kind of processed.
Pretty much any sugar.
Yeah, sugar was
sugars.
definitely out.
Right.
That was really hard.
Right. Sugars really make the body acidic.
Yeah.
We know about diabetics and diabetic ketoacidosis, right? So an acid pH tends to allow cancer to grow,
Yeah.
and a slightly alkaline pH tends to suppress cancer growth and kill the cancer. So fresh fruits and vegetables are on the top of the list in making the body's pH slightly alkaline. You were doing a lot of juicing too.
Yes, absolutely. I started to really enjoy that, and I would even have that just as the meal. We were doing some of that, and but it wasn't that hardcore all the time. We did like a lot of salads, and we did like salmon.
Yeah, you
Yeah.
could eat fish.
We had salmon with, and instead of doing dressings, we just did like squeezed lemon
Mm-hmm.
as
Yeah.
I go, this is my dressing. And,
Yeah. Yeah, I'm sure it's not as tasty as papaya seed dressing.
well, you know,
Thousand Island dressing.
as your body starts to get into this alkaline mode,
Yeah. Starts to taste better.
yeah, you look forward to these meals, and
You mentioned fish, so but you have to eliminate the other meats, like beef and pork
yeah,
and chicken and turkey,
yeah,
because fish is the easiest among the meats to digest.
yeah,
Basically, beef and pork and other meats are difficult to digest, so it tends to make the body's pH more acidic.
that part wasn't so hard
The
for
meat
me.
part?
Yeah, because my wife and I were more fish eaters anyway, so that transition was, you know, it just went kind of smooth over to the fish. It was the sugar thing
That was hard for you,
that was tough. Yeah,
right?
that.
Yeah, you know, no doubt, you're not alone, Jace.
I love sugar.
That industry is huge, right?
Yeah, it is.
Not only in America, but the world. But sugars, again, tend to make the body more acidic. And that's why we had to get the simple carbohydrates out of Jason's diet, which was foods like, you know, all the dessert type foods, right? Cookies and pastries and pies, ice cream, but also things like white rice,
That
pasta, noodles, bread, crackers,
Yeah.
Alcohol, juice and soda that was not fresh squeezed or freshly prepared.
absolutely.
Yeah, and so was the diet fairly easy for you to change into?
After, like I said, after the 2 weeks, it started to get easier.
Okay.
One thing, it takes a little bit of preparation.
Yeah.
You know, so people who are looking at this, just be prepared that there's going to be a little preparation.
Yeah.
Like any, you see on like these cooking shows and everything.
Yeah.
A lot of it is the prep, but
Yeah,
this one
yeah.
is like it's a little different. You get used to it though, but it takes a little time.
Yeah. It's not going to be a quick
No.
kind of
Oh, no.
fixed meal. All right, Jace. Besides the alkaline diet, I mean, we could talk about the alkaline diet pretty much all day long. But besides that, we also gave you some naturopathic immune strengthening supplements to take.
Oh yeah.
Yeah. Have any opinion on those?
Okay, I do. It was interesting. Once I started to get into the diet, and I was also on the supplements. There was a time when my family came down with a cold, just a simple cold. And here I am, the guy that's compromised with all this surgery, and I don't get it. And so that was kind of an awakening right there that something is going on here now that I'm not just taking all these pills and, because the doctor said so. This is something that is having some kind of result, and I can see that indeed my immune system was boosted, even though I was compromised, and that was an awakening for me too, right there.
All right. So you had 2 surgeries,
Yeah.
Abdominal surgeries before you came in to see me,
Right.
and you had a 3rd schedule,
Right.
right? Soon after you saw me for
Oh,
the
yeah.
first and second time. Can you explain why you had that surgery scheduled, and what happened during and after the surgery?
Okay, the 3rd surgery
Happened in May 2007.
Yeah, so that was almost a year. It was a little over a year since my 2nd surgery, and during the course of that year, I was feeling pretty good that I was going to kick this thing, and I was going to live healthy, and get, this is going to be something that's going to be in my past. But what happened was I went, for me, for the rest of my life, I have to do MRIs every 6 months. So doing one of the routine MRIs, the cancer showed up again.
Mm-hmm. This was in 2006 or 7?
Yeah,
Okay.
after that 2nd surgery.
All
So,
right.
My doctor says, it's back, so brace yourself, it's in both kidneys again too.
Mm-hmm.
So I was feeling pretty low at that time.
So even though at the beginning of 2006 you were saying that you were believing that you're going to kick this thing,
Right.
and you're going to conquer this thing and move on.
Yeah.
So you were feeling it.
Yeah.
You had the faith.
Yes, absolutely. Had big faith.
Yeah, and then the tumor came back.
Yeah.
Okay. So, and that's why you had the surgery scheduled in May 2007.
Yeah, absolutely.
And then what happened during the surgery, after the surgery? What did you feel or experience?
Just prior to that, I came to you and I started on your program, knowing full well that starting this alkaline diet, it's going to take about a good 6 months before you're fully acclimated to it. I guess that's the word for that, or whatever.
Yeah.
And I said, well, I'm going to get surgery in 6 weeks after visiting, but now is as good a time as any to begin. So I did it. I began, and I didn't want to do it halfway, so I really did it as good as I could do it, and had the surgery. And then, I didn't want to say that I was getting to be pretty much an old pro at this thing, but I kind of know how my recovery is going to be, because I had 2 of them prior, and same big surgeries. And what I did before each surgery was I would train. I would train.
Try to get your body ready.
Right. So I would get my cardio, get that all up, keep myself really toned and everything. I'm going to be going in there as 100% as I can when I go in there, because I'll be compromised, but I want to be able to bounce back from it. So
Right.
I did the same thing with the 3rd, but I noticed that after the surgery, I was feeling more upbeat a few days after, right after, and all of my surgeries I would walk the next day. I'd just get up and walk. But this time I did that routine, and then when I got home, it was about a week after, I started riding a bike, which was kind of a little bit crazy, but I rode my bike.
You didn't tell your surgeon this.
I did later,
Okay.
and he said, "Don't ever fall down because you'll fall apart because you're just being held by stitches."
Right. You have your innards on the
Yeah,
ground.
so, but, I had the wherewithal to get on my bike, and
You're feeling pretty good, I guess,
I was
to want to do
feeling
that.
really good. Recovery was really quick and interesting. Aside from all this, in a way, I kind of enjoyed that because, like, I would see progress daily.
Mm.
Like, I could quantify, like, how I rode my bike.
Oh, okay.
Like, I would do a longer course, or
Yeah.
I'd do the same course quicker, or
Yeah.
whatever.
Yeah.
It was just, and then the breathing started to come back.
Okay. So you healed faster off?
Yeah, all
And you-
around. It
And you
was,
felt better
I felt
sooner?
absolutely better. Yeah.
All right.
So
All right. But unfortunately, again, in August of 2007,
yeah,
you had another
that one I had
surgery
to go through. Yeah, because
schedule.
because it's in both kidneys.
Mhm.
My doctor didn't want to do two at once.
Okay.
Yeah, because he said it might be a little too risky, and you run the risk of having both kidneys shut down.
At the same time. Yeah.
And
Okay.
then I'm going to be a dialysis patient, and
Yeah.
we didn't want to go there. So we're going to do it one at a time, even though it's going to go through this painful process. So we went and did this thing again, knowing I knew full well I was going to go under again in August.
Mm-hmm. Okay. And I think you were doing the surgery on your right kidney in August 2007.
Hmm.
So this would have been your fourth abdominal surgery.
Correct.
That's a lifetime's worth of surgery, right?
Yeah,
there,
it
James?
was, and it was like a lot of scar buildup. So each of these surgeries would be more and more difficult
Mm.
and
To perform.
Yeah, and my doctor would have another urologist in there, two of them working on me.
Yeah. I'm sure you needed some help.
Yeah, he did. I mean, it was just not an easy thing. And
All right. So, how did this surgery go?
okay, now at this point, I had been on your program, your alkaline diet program, for about 5.5 months.
Mm-hmm.
And so it was miraculous. That's all I can say. It was after each surgery, all four of them, my doctor would come in and he would tell me that whatever pieces they cut out, it would send to the pathology, and it'd come back, and then he'd read what they wrote. And I have a lot of cysts in my kidneys. And so, he said, yeah, we got all the cancer, but you have these cysts in your kidneys. And a lot of times, in normal people, it's benign.
Mm-hmm.
But mine, they test positive for cancer.
Mm-hmm.
So, in other words, from one of these, it's going to start up again.
Mm-hmm.
So he told me that like 3 times out of the first 3 surgeries, and now this 4th surgery, he was there 6:30 in the morning, and he goes, okay, you're doing good, and we got all the cancer, and we have some interesting news for you.
He said interesting.
Interesting is what he said. And he said, your cysts are testing negative for cancer. And it was just my wife and I, and the doctor there in the room, and hallelujah.
I'm sure.
And my doctor was like, I don't know what you're doing, but keep doing it. And he said, maybe one day you can tell me and share with me what it is that you're doing. He goes, I'd like to know, because, he goes, I'm always on this side of the line, so I'm always doing surgeries,
Yeah, he's focused on what he's doing and
Right.
no clue what's going on outside of
Yeah,
that.
and we're all human, things can happen to him, so
Yeah,
it was
yeah.
very interesting. It was nice.
That's a dramatic change.
Huge.
Huge. I mean, you go from pathology reports of your kidneys always being malignant, positive for cancer, and then this fourth surgery, which is the right kidney opposite from the left, that you had the surgery a few months later that
Right.
tested positive,
Correct.
comes back being negative.
We were expecting,
The same.
correct,
Yeah.
that
Yeah.
they're going to say it's still testing positive, and we're looking at, in my mind, I was going to go through surgeries in 08, 09, and all this kind
Yeah.
of,
Yeah.
you just kind of spiral, so
Right.
I didn't want to go there, but, these thoughts pop up,
Yeah.
so.
Yeah. Yeah. You can't help but think about those
Yeah.
things, I'm sure. I don't know if this is true or not, but I would think he doesn't see that happening very often, especially when it comes to von Hippel-Lindau.
I can't recall now if he had another von Hippel-Lindau patient. I think
Okay.
I was.
You were his only one.
Yeah.
Okay. So, but that was just the cyst in your kidneys were negative for cancer now.
Mhm.
But it doesn't mean that you're never going to have tumors growing you now, right? Because with von Hippel-Lindau, because of the genetic defect of your immune system being turned off, typically it means that cancers just keep coming and coming and coming. So what has happened with the tumor growth since then?
Since then, there's been no tumor growth.
There's been zero tumor growth since that surgery.
Yeah, since that one. I had a episode with scar tissue, but
Oh, it was forming adhesions causing
yeah.
problems.
I had to get surgery for that.
Yeah.
But that was not fun either. But
Another abdominal surgery.
yeah.
Yeah.
I had
Oh my
to
gosh.
deal with that. But
Yeah.
that was not a cancer thing.
Yeah. So Jason, when your surgeon told you that there's been a dramatic change in your situation where the cysts weren't cancerous anymore, what were you thinking?
It was all God.
Yeah, it's a miracle.
Yeah, it's an absolute miracle. It was not a miracle, it was many miracles.
What was your wife thinking at that time? I mean, obviously she knows, what von Hippel-Lindau is.
We were both on the same page. We were like, this is God's work.
Hallelujah.
Yeah, big time. Thank you, Jesus. It was awesome. It was an awesome time. In fact, that evening, a friend of ours from our church came to visit on that very same day of the good news. And when she came into the room, it was like as if an angel was coming into the room. And it was like an affirmation for us. Like, it was like kind of like a message from God,
That God's present.
He was there, and she was. It was like, wow, this is a overwhelming day. This is very miraculous. And
you had any days better than that day?
oh, that was huge. I mean, faith-wise, our faith in God was just like,
Yeah, through the roof now.
absolutely.
Yeah, I mean, what von Hippel-Lindau disease is, and
Absolutely.
the diagnosis of von Hippel-Lindau disease.
Yeah.
I mean,
It's very grim.
yeah.
As a
Very grim.
As a matter of fact, I think my sister-in-law had one of her patients, somebody related, had that von Hippel-Lindau, and it, unfortunately for that person, it manifested in his brain and spine and his eyes. So if it manifests there, you're dealing with, I had a whole slew of things to deal with too, but now it's a whole different set of things though. I mean, So
It's encased in the brain.
yeah, and so you have to deal with like physically being compromised,
Yeah,
and your sight start to go.
yeah, yeah. Yeah, starts pressing on nerves and things, and hard to get into the brain,
Yeah.
right, surgically. It's not the easiest place
No.
access. Yeah. All right, Jay, so you had mentioned earlier that typically you get MRIs done every 6 months or so. So you've been having MRIs done every 6 months since 2007.
Pretty much right on, right on schedule.
You want to know. And each and every time comes back negative for cancer.
Yeah, it's almost getting routine, like I have to catch myself though, like
yeah. You don't want to be too confident.
No. So, but it's been good. It's a blessing.
I mean, this is incredible, right? Because
Big time.
I don't think this happens very often with
no.
hippel-Lindau disease.
No.
So, I'm sure your physicians, being men of science, right? They understand what the diagnosis is about. Like, what do they say to you when you go in to see them, every 6 months or whatever, and you come back with negative diagnosis for any tumor growth?
First of all, my surgeon is happy.
Okay. He's human.
Yeah, he doesn't want to go in there anymore.
Oh yeah, I'm sure.
He was explaining to me the difficulties of this much scar tissue. So it just gets harder and harder and harder to keep going after that. And so he can do it, but
It's difficult. Yeah.
And
it's not easy work.
No, and he even confided to me that he would have a hard time sleeping the night before,
knowing that
it
would be a tough.
It's going to be me there.
Yeah.
I'm one of his tough patients.
Yeah.
And so it's a real test for him.
Yeah, and I'm sure he's worried about you too.
Yeah,
right?
Absolutely.
Because part of it all is, especially with the kidney cancers in von Hippel-Lindau disease, that's the number one cause of, number one killer for individuals diagnosed with von Hippel-Lindau disease. Is typically there's so many surgeries being done that they take out too much kidney tissue. Potentially, and they succumb to that, or the tumor just kind of overwhelms the kidneys. Yeah.
I could see where even just the wear and tear of
the
surgeries after surgeries, and you start to spiral, and it's really compromising.
Well, Jason, how are you feeling today?
I feel
great. Life must be good.
I must say that whole episode, it was modern day miracles that happened.
So Jason, you overcame this really deadly genetic disease, von Hippel-Lindau disease. Obviously, I would think not many people would have the outcome that you've had. What do you think was the main driver or influence in you having a good outcome with von Hippel-Lindau disease? What treatment that you did maybe did the most for you?
First of all, faith in God is there, and guiding me to this diet. It is a natural diet, that's for sure. Absolutely, yeah. And it was interesting. I was before I came, I was reading the Bible in the book of Daniel.
Okay.
There's this where the king Nebuchadnezzar, he overthrows another kingdom, and he takes 4 men from the other kingdom, and he's going to use them as royal servants. So these got to be like top guys. And he brings them to his kingdom, and they're wise young men and they're fit, and he's going to treat them royally because they're going to be like advisors to him and things like that. So he presents them with they'll be eating good. You know, they have a good
really
spread.
rich
Yeah,
foods.
a lot of wine. You know,
Right.
and it was Daniel that turned down this whole thing, this whole eating. He didn't want to defile himself by doing that, and so he asked for if we could have a diet of vegetables and water. And the attendant that was taking care of them, he says, "No, you know, I cannot ask for that because if you guys start to get frail and thin and pale and everything, I'll lose my head."
Yeah,
so
he was responsible.
Yeah,
for
he
that.
didn't want to do that. But so Daniel asked, "Well, let us do this for 10 days, and then let's see how we fare." And so after the 10 days, they were looking perfectly fit, and they were mentally sharp and everything like that. So there's reference to this sort of diet in the Bible, you know. So
right.
it was there.
So Jason, you made the change too, and you mentioned Daniel was physically fit and mentally sharp. Did you feel the changes in you too?
Yes, I did, and it's interesting. I kind of wanted to talk about like us as a society, and like how we've been kind of brainwashed to eat like how we eat, and our foods has become more and more processed. It's more convenient. It's more accessible. You know, things that are out of season we can have year round.
Right.
You know, and in the processing, there's like a lot of preservatives that are added to it, and there's hormones in it. There's flavor enhancers in it, and a lot of times the actual food that is being processed is processed to a point where it has like no nutritional value.
Right.
And so hence they have to flavor enhance it, and there's all these things, and we just we get bombarded with these ads and everything, and all of a sudden we're buying it, and lo and behold, it does taste good.
It tastes great,
and it's actually kind of like addicting, like
right.
you eat it and you want more, And so to go to like this naturopathic diet, this alkaline diet, and eat whole foods and juice, and you're eating pretty much live plants. It has all its nutritional value still there, very intact. It's all the enzymes and everything. And there's no preservatives, no flavor enhancers, and to me, God designed us to be able to heal ourselves. And like in the book of Daniel, he knew that eating good food, healthy food, you'll be in a very healthy state.
Right. It will keep you. It will bring health to you, and potentially prevent these from coming.
Yes, absolutely. Yeah. So it creates this condition in your body where your body has an easier time healing itself.
Right.
And
that's exactly what you did, Jason.
Yeah.
Yeah.
And very interesting. Yeah. And I even noticed that, especially with immune boosters and all that kind of thing. All of a sudden, indeed, my body was healing itself, and I'm pretty sure that was very instrumental in like staving off the new cancers that were there. Keeping that at bay.
Right. Because you probably did have some seeds of cancers in other areas of your body back in 2007 when you had that third and fourth surgeries, right? But then all of a sudden after that last surgery in August of 2007, no tumor showed up on MRI. So Yeah. The body can heal itself, and that's what naturopathic medicine, basically that's the founding principle of naturopathic medicine, is that the body can heal itself. All we have to do is remove the obstacles to healing. A lot of it is our diet.
Yeah, what you put
we
in your
keep tripping
mouth.
ourselves up. It's not a sexy diet, though, right?
No,
I mean,
no.
but you got used to it.
Yeah, it's not bad. I think as we went along, the juicing aspect of it for us was kind of working.
Yeah, yeah.
We kind of like that, although that too again is not just slapping. It takes a little preparation to do stuff like that. That was good.
Yeah. Do you have any advice you can offer to people who might be wanting to change their diet to a healthier diet? Do you have any thing you want to say to make it maybe easier for them?
Let's see. I would say, do it.
Just
Do it.
Just do it.
Because it is. The longer you delay, the longer your body is going to be in this condition where it cannot heal itself. And a little side note for me, I was at like 6.25 on the pH scale.
Okay.
And I didn't even make it to 7.
Mm.
I just got it to like 6.75.
Mm-hmm.
And maybe a couple of good days I'd almost get to the 7, but I never did. And the cancer at that point in time, though, it had just gone away.
Yeah,
It
you
just
raised
stopped
it enough.
Enough that it stopped.
All right. Jason, I know you probably didn't know much about naturopathic medicine before you came in to see me.
No, not at all.
Nothing. Did you have an opinion when you came in to see me about naturopathic medicine?
Well, the rabbit food thing, that was... I came in with that. I was like,
this is what they got.
No more cake and ice cream.
What do you think about naturopathic medicine now, the alkaline diet now?
Now, I'm starting to see the bigger picture, especially when you think about how much of the food that we eat is processed. It may not be totally all processed, but there's some point along the way that it goes through some kind of processing, and that's where a lot of the nutritional value of it is compromised. And if it's like meats and stuff like that, it's probably got a lot of hormones in it, and stuff like preservatives or flavor enhancers, or a lot of sugars.
Oh yeah.
It's insipid. It's in everything.
Unfortunately.
Yeah.
60 Minutes had a really nice piece on sugar and its role in causing disease. They interviewed 3 scientific experts in the field of research. The second gentleman, he was a scientist, and his expertise was in the research in cancer. And he said they're finding interesting things about sugar. And he said the one thing they found out is that sugar actually causes cancer, and then sugar causes cancer to grow faster. And that's kind of what we talked about earlier. I mean, there was some evidence of that through research before, but they're finding even more now.
And it's good that they come out and speak out about that, and rather than keeping it under wraps. It's like it's a very addictive substance.
It is.
Sugar.
It is. The third scientific expert was actually on. He was an expert researcher in addictions.
Oh, there it is.
And yeah, he said that sugar was as addictive, if not more addictive, than cocaine.
Oh, absolutely.
That's
not
why
that I was into cocaine, but
yeah. But that's
sugar was
why
a big
we
deal.
have such a hard time with giving up sugar.
Yeah.
But and the diet change is tough for most people, and I think that's probably a big part of it, right? Is we've been raised on sugar. Like you're saying, sugar has been put into all foods, kind of insidiously. So we have this. We have been raised with having sweetness in our taste buds, and if all of a sudden we're not eating the sugar.
Yes, that was hard. That was the hard part of my transition.
Do you miss it now?
I still have it,
Every now and then.
Yeah, it's not like before.
Mm-hmm.
And after the first 2 weeks on the alkaline diet, all of a sudden I started to not have craving for it.
Mm.
And so once you can get past that, maybe for some people it might not be 2 weeks, it might be shorter, Just try and stay away from it and see what happens, if you can just do without sugar sooner. I mean, and you start to have your taste buds all of a sudden actually start to taste things again.
Yeah, the real food.
Real subtle flavors all of a sudden become,
stronger.
Very
Yeah.
good.
Yeah, you can actually taste the sweetness in vegetables.
Absolutely.
A lot of patients notice that.
Yeah.
And the different types of tastes in foods.
Mhm.
Yeah, from not only sweetness but other flavors that might be in
Absolutely.
certain foods. So, Jason, you you're beating probably one of the deadliest diseases that are out there. I'm sure a lot of patients are wondering, or a lot of people out there are wondering, do you think about it all the time? Is it tough for you to get those MRIs done?
No, it is not.
Yeah.
This is a gift from God to me.
A blessing.
Yes, the big blessing, the big miracle.
Mm.
When I go to do these, I always, my wife and I, we always go through our little prayer, and and when I do go to the hospital, I know that God is with me.
Mm.
Absolutely.
You sound like a very religious guy.
I wouldn't say religious.
Okay. Strong Christian. Before you were diagnosed with von hippel-Lindau disease, how was your faith back then?
Oh, it was no faith.
No faith?
Yeah.
You found God pretty fast with the diagnosis?
It went like that.
Yeah.
All of a sudden, I was going to a mini church,
Mm.
and then I started going to regular church on Sundays. And,
You had a lot of support during this whole
I
process.
did,
right?
absolutely. Maybe I could give a little shout out to Hope Chapel Olamana High.
Yeah, please do.
Their prayer team diligently prayed for me, got me through this tough time in my life, and it's just been an absolute blessing. I would like to say, it was a modern day miracle.
Mm-hmm.
You read about miracles in the Bible and stuff like that. Well, there's miracles still going on in the world today, and right here in Hawaii, right here in me.
Yeah.
I can attest to that, because not only was I battling the cancer, there was conditions that sometimes was very grim, and I miraculously got through that too. There was a time, my third surgery after I started with you, we were going in looking at this new cancer that grew around the artery to my kidney. And so rather than, resecting pieces of the kidney, we're looking at total removal. And then, that's just one more step closer for me to be on dialysis. And,
Mm-hmm.
and here I come out of, I'm in recovery, and my surgeon's there, and he said, we're going to have to cut the kidney, I got to the cancer, and it peeled off.
just came right off.
Huge miracle.
Yeah. Normally the tumor might be actually growing into the kidney
and
tissue.
then that's it.
Right.
That was one of many
miracles in this journey.
Yes.
Yeah. So yeah, for sure, I'm sure you believe you have strong faith in God.
Oh yes.
No, man. So Jason, you were diagnosed with von Hippel-Lindau disease. Very devastating diagnosis. Typically, people die, and they usually die really quickly, within about 3 years or so.
Mm-hmm.
What would you want to say to anyone who is out there with von Hippel-Lindau disease, or any other cancer for that matter?
We are all children of God, and God loves us all. Seek God, live obedient lives, read the Bible, pray, and you will be blessed.
That's for sure. Pastor Wayne Cordero always says, if you knock, he will answer.
Well, he answered big time.
You were knocking pretty loud?
Maybe it was more like pounding, desperately.
Yeah.
But back then I didn't understand it. Accept Jesus in your life as your Lord and Savior.
Yeah. You were talking about you're a modern day miracle. A lot of people who have seen your program, whether they're patients or not, they actually do say that you're a miracle man.
It is.
That is a miracle, one of God's miracles, that
big time.
You have come out of it on this end, alive and well, and you're healthy, right?
I would like to think so.
Naturopathic medicine not only made, a change in your life that has been helping you. Would you tell us about the other support that you've been receiving, not only from your family? I would imagine your wife has been a big support.
Oh, absolutely.
Yeah.
She's been the biggest because she's kind of in the industry. She's she has a massage therapy business, so she's well connected in her field, and she meets with a lot of, I guess, naturopathic people, and so she's the one that I was stubborn. Of course.
The husband is almost always the one that
she had to keep pounding. Yeah, not knocking, pounding.
So it took you a while before you came around?
Yeah, it did.
Yeah.
But, with the help of recurring cancer and all of that, all of a sudden, bam, there I am.
That would get you motivated.
Yeah, going to church with her, and then jumping on the bandwagon, coming over here to see you, talk to you about rabbit food. Okay, here we go.
No, you're making it sound bad.
No, it's not bad. It was all good.
Yeah. So, the alkaline diet, very positive in your life. Not many people understand the alkaline diet. Maybe that's something we can talk about some other time. But definitely eating more fruits and vegetables, fresh fruits and vegetables, by the way, not frozen, not canned. And if you're drinking vegetable and fruit juice, it should be fresh also, not anything that's coming in a jar or a carton or a can, right? Because when it's fresh, that's when you turn the body's pH alkaline, as opposed to if you're drinking it from a bottle or can, it's going to turn the body's pH more acidic.
Right.
All right.
And those are nutritionally dead.
Dead by then, that's right.
Yeah, it has no real nutritional value.
Mm-hmm.
So.
And Jason, you're speaking like a true healer now.
Yeah, and I believe that God created us in His image, and He gave us bodies that actually are quite capable of healing itself.
Mm-hmm. Yeah.
And because of, it's just the way how our world is going now. It's and what we put in our mouth and processing that food goes through, and I guess even what we value, like a lot of times it's convenience, and
Right.
and so they think of quicker, faster,
Right.
you know.
Yeah, we are making ourselves unhealthy, you know, and we're seeing that. I mean, we're a wealthy country, but yet our health isn't
Oh no.
the top either. You know,
It's
we're
all
somewhere
pretty awful.
down in the middle to lower part of that spectrum. So definitely we need to try to eat healthier as a society and look at preventing disease
There you go.
as opposed to treating disease.
There, yes, absolutely.
And then maybe we won't bankrupt our government. All right, Jason, I'm sorry to say our time is up. I want to
Okay.
thank you again for joining us and sharing your incredible story on Island Wellness.
Okay. Yep, and thank you everybody that for supporting me and praying for me, and here I am, you know, testament to your prayers. I'm still alive and healthy and thriving.
Right. And I don't know if I had mentioned at the start of the show, I'm going to anyway, but today is February 26, 2013, so Jason's still here at this time, and would you be interested in coming back maybe in a couple, 3 years for another update?
Oh, absolutely.
Sounds good. All right. I'd like to thank all of you for tuning in and joining us today. I hope that you enjoyed the program and learned something of value. Our hope is that these stories inspire in you the hope that true health is attainable and you can have it whenever you are ready. Please continue to look for and tune into Island Wellness on Olelo Television. We have more incredible heartwarming stories of people overcoming incurable disease and illness in the next few months. Watch Ron tell his story of beating the incurable and disabling multiple sclerosis. If you're still wondering if naturopathic medicine can really cure psoriasis, Annette and Evelyn returned 2.5 years after their first shows to update you on their psoriasis status. Finally, can naturopathic medicine heal a severe skin infection without antibiotics? Did you ever hear the adage, a picture is worth 1,000 words? We've got pictures. My name is Dr. Jason Uchida. I hope to see you next time. Goodbye.